With 40% of the population now classed as overweight and 23% of people clinically obese, Ireland's experiencing a high demand for cosmetic surgeries.
Here to discuss fat removal surgeries and the pros and cons of undergoing cosmetic procedures is Dr. Patrick Treacy and his patient Lorraine Lambert. Good morning to you both.
Good morning.
Patrick, I want to come to you first because we were just chatting there in general about fat, and we'll come back and talk about what causes fat and obesity, all the rest of it. Today we want to focus on the most popular form of fat removal surgery, which is VASER. Now, a lot of people haven't heard of this. Can you explain to us exactly what VASER is?
Absolutely. If we just look at the skin has got this upper layer, the protective layer, the epidermis, the inner layer, the dermis, and below it, the fat. So what we want to do is get to the fat. The old methods meant going through the dermis, mechanically disrupting the nerves, the blood vessels, so this took a lot of time to heal. Patients were left with bruising, patients were left with pain.
Very invasive.
It took up to 6 weeks to heal.
People were left battered, really.
Sure. Yeah. What we can do now is just put a little probe, and this is the probe, this size.
That's the actual probe?
That's the actual ultrasonic probe. Put it down into the centre of the fat.
Yeah.
It liquefies the fat, emulsifies it, almost like melting butter.
How does it liquefy it?
The ultrasonic probe vibrates the cells, and as a consequence, the cells rupture. What we do then is we bring them the fat, we suck it out into a thing like this here, and we end up with, this is like 1.2 litres of fat.
That's somebody's fat?
That's somebody's fat, and in a normal sort of person, we'd probably take off 2 and possibly 3 of those.
3 of those containers from the average person?
Sure.
And does it take long? Is it a long process?
Probably takes, it goes through 3 stages. You've got to emulsify, then you sort of got to aspirate it out, but beforehand it can all be done under local anaesthetic, and this is why it's become so popular. So it takes about 2 hours, maybe 2.5 hours. Patient can sit and watch television when it's been done.
But
and more importantly, they're not battered and bruised afterwards.
Absolutely. You'll heal. You can be back to work. I had it done myself within 2 days. Actually, I had it done, believe it or not.
You had VASER, Patrick?
I had VASER done. Well, I wanted to prove that it could be done under local anaesthetic. So in 2003, I went to Eindhoven, and Peter Veldhuis, a friend of mine, we did it. We weren't the first with the technique. It was known in the United States you could do liposuction under a local anaesthetic. But what we decided was, we looked at this technique and we said, this would be fantastic. Nobody wanted to do it. I had it done on myself, and now it's a worldwide procedure. We brought it to Ireland in 2006.
OK, Lorraine, well, Patrick would say all that, wouldn't he? I mean, we love him dearly, and he's very credible, a clinician and all the rest of it. But you're a patient, a client.
Yes.
You went and paid your good hard money for it. Yeah. And were you happy with the results?
I was.
Does it live up to the billing?
It does, definitely. For me, it wasn't that I had to take a lot of weight off or something. It's more for sort of like shaping my legs a little bit on the inside.
I was going to say, you look
knees.
very fit. You don't look like you're carrying a lot of weight.
Yeah, I do a lot of exercise, swim a lot, blah blah blah. But you know, some women inside the legs, you've got by the knees. You know, if you wear a skirt that's kind of like there, it shows, and the shape isn't good. So that was what really bothered me. I think everybody's got something that bothers them. That bothered me.
Yeah, no matter how much exercise you do, every woman has some bit that you just can't shift the fat off.
That's it. So no, now I mean, I'm not into mini skirts or whatever. I don't like that kind of thing. But okay, a normal skirt, and the leg looks a little bit better. The shape is much better. Definitely.
But women everywhere are going, okay, well, is there a dress size reduction? Is there a weight loss reduction? Like what?
There's
what
not
did you
really
experience?
A weight loss reduction. I think it definitely there's a dress size reduction. You'd easily lose a. I think I lost 1 dress size, definitely.
One definite dress size drop.
People forget about fat. Fat's very light. Fat floats on water. Cream floats on top of milk, and so as a consequence, fat isn't that heavy. So even though you could take off, that amount of fat, it actually, you may not see that much of a difference.
So they stand on the scales and they go, oh, but where's it all gone? But, but there is a reduction in size and silhouette, though, Patrick, isn't it?
Absolutely. Oh, very much so. It's very much a shaping thing.
What about it coming back?
Then?
What's the other thing as well? Because I mean, I remember reading these horror stories about the original lipo when it used to come back, and used to come back like clotted cheese in lumps and stuff.
Sure. We should differentiate one thing as well. There's 2 different types of fat. There's fat that surrounds organs that kills you. That's visceral fat. It goes around your liver, it goes around your heart. This type of fat we're talking about is subcutaneous. It's above the muscles in the abdomen. It's very easily reached by sort of liposuction, but it does you no harm. It's aesthetically not very pleasing.
So this isn't a health issue. This isn't for obese people who are worried about dying of a heart attack.
It is to an extent because it kicks people into getting rid of the rest of their fat. But the interesting thing about it is that if you diet and exercise, you get rid of the visceral fat. The subcutaneous fat tends to stay there. So women will tell you, I've been going to the gym for 2 years, I can't get rid of it. And it's only known that diet and exercise is only about 7% effective in getting rid of that, whereas diet and exercise for visceral fat is much higher. It's in the 50%.
So you can diet as much as you want, you can work out as much as you want, but you won't shift that bit of fat on your tummy, your bum, your hips, wherever you carry it.
The is probably truer to the fact. In 30 minutes, you can get off what you could take running around the block for 2 years.
And when you take this off, Patrick, does it come back?
I think that it can come back, yes. The cells themselves won't come back, but the cells that are there get bigger. And this leads us into what we think now may be going on in terms of adenovirus and infection. We know that people who are fatter test positive for adenovirus. We know that kids have 3 to 4 times a higher rate of adenovirus than their obesity. As yet, we still haven't worked out whether obese people are susceptible to adenovirus or whether the common cold may be one of the contributors of obesity. And this makes it fascinating from the point of view that obesity may be an infection, not a disease at all.
So fatness might be a virus. We'll have to bring you back and talk about that, Patrick.
Okay.
Lorraine, have you experienced any, has it come back? Is it still the way it was after you got the operation?
Because it was just that kind of area that I was focusing on. No, it hasn't come back.
Were you sore afterwards?
There's soreness for about a week, but it's mild. It's sort of like a really heavy gym workout, you know.
And what about scarring? Is there any scarring?
Got a tiny, fine little opening area, so it's more like a spot. It's not bigger than
and
about 2 millimetres.
It's nothing that would bother you?
Yeah, no,
That's
not
the
at
size
all.
of the hole that sort of it goes through.
Wow.
And you probably need 2 ports, one here and one here.
So you can literally be back at work
Still,
the next
Patrick,
day.
if somebody stuck that in you, you know all about it.
It's better than the old hoovers they used in liposuction.
The cannulas were like medieval almost by comparison with what you're using now.
And it was mechanical rupture of the fat cells.
I've seen documentaries of it done. It looked awful. It looked like people were being sawed. But anyway.
I suppose it was off the period and the technology improves.
And of course the other thing is, I hate to do this, it's mentioning filthy lucre and all the rest of it. How much did it cost you?
€2,000, yeah.
Worth every cent, you think, Lorraine?
It was a small procedure for me, but absolutely.
This is
Thrilled
I
with the
think
results.
£6,000 for handbags these days, for God's sake.
Not anymore, Mark, not anymore.
Thank you very much indeed, Patrick. We have to come back and talk about the idea that obesity could actually be an infection rather than just, you know...
Particularly with gastric banding.
Yeah.
So as a consequence of that maybe governments will have to...
We'll bring you back, Patrick. Ailesburyclinic.ie for details on how to get the VASER.
Right.